Okay, so this is going to determine if we're in the same age bracket. Have you ever heard of this before? Calgon, take me away. So if you haven't, then you guys aren't old like me. So anyways, Calgon, take me away is one of those commercials from the 70s, maybe 80s. And someone is stressed out or in pain, but it's more like, oh my gosh, help me, leave me alone, take me away. And when you have a kidney stone, that's basically what people feel like. Some people explain it being worse than labor. It's very painful. Do you know anyone that's had one before? Most likely, most of you have, I'm thinking. They are very common, more common than we think they are. So I could talk about this all day, so I don't want to take up all your time on this. So if you have any questions, you can always email me and we can talk about this further. Just since I've worked in urology, it's just, I feel a passion for this area. All right, so what I wanted to show you are the different types of stones. And really the types of stones, the most common ones, and maybe not so common, are in this picture right here. Most commonly being calcium stones, or otherwise known as calcium oxalate stones. They don't even always look like this. This to me looks like more staghorn shaped, because remember they come in different shapes. Like here's more staghorn shaped, but sometimes they can come smooth like this. These are most commonly, when I see them, more of the calcium oxalate stone appearance. Struvite stones, it's less common. Uric acid. So what are stones? They're basically buildup of a mineral, and it's for various reasons. So most likely is diet, not drinking enough water. Genetics plays a big component in that also. Silica stones I've never seen in my life, but I suppose it's out there because we know it's here. Xanthine stones I've seen before, and cysteine, but the most often, these first three are the most common ones that I've seen in practice. Well, with this one being the most common that anybody will see. And they can range in size, is why I put this picture here. If you have anything less than 3 millimeters, you'll probably pass it just fine on your own. But if you have anything more than that, there is some risk of it getting stuck in the ureter or not even leaving the kidney to even pass down the ureter area. We have seen some 15 millimeter stones. So if you can imagine how big those are, those aren't going to pass at all. So really make sure that you understand the diet and prevention of stones. And each type of stone would be a different type of diet or food choice that the patient would have to, stay away from. So for example, the calcium stones, it would be more, they'd have to avoid some vegetables, nuts, chocolate, and fruit. Whereas someone with uric acid stones, when we say high in protein, what are the highest in protein? So we think like organ meats, some like we always say sardines. Not very many people eat sardines, but red meats in general. We also see a lot of men that drink a lot of alcohol that can have uric acid stones form. And many of these people, more often men than women, tend to form uric acid stones, and they have a history of gout, which is hence the buildup of uric acid. I also want to show you the difference between ureterolithiasis versus nephro. I always say my medical terminology class almost 30 years ago was the best class I ever took, because all you have to do is divide up the words. So lithiasis, this is condition of. Lithia is, and a lot of these are Latin terms, stones. So you have stone, and this is in the ureter. So the stones are in the ureter. Nephro, that's the kidney. So the stones are in the kidney. So that's the difference when you see those two terms. Another thing I want to go through is stones forming. So you can have a stone up here. You don't have to know this, but this is just for your own knowledge, because I think it's real important to understand kidney stones. When you see a kidney stone and they say it's in the upper pole of the kidney, that's here. If it's in the lower pole, it's here. So we often see them here, and they won't come out because it's gravity. And unless you are tumbling and doing flips, most likely the stone, and obviously it's a lot bigger than it really would show. It would be probably like a dot in the kidney. It's not going to just jump up and fall down the ureter, whereas these up here are more likely to fall down. And so they usually come from this upper area and fall down the ureter on into the bladder and out, hopefully. Sometimes they can cause obstruction. So what would happen if there is obstruction? You would end up having hydronephrosis to the opposite kidney. So if you have a stone in this kidney right here, then things are backed up and you're going to end up having swelling of this kidney, because remember, urine's now having to, it's being backed up here, and this is working on overload. There are 3 areas, though, when a stone is being passed that they can be obstructed. So right here, when it's coming out, is one part where it can get stuck. And so many people start having significant pain here. Or another area is right here at this ureterovesicular junction. This is where the iliac and renal artery cross over, and it's another tight spot. So if you have a bigger stone, greater than, I'd say 3 to 4 millimeters or higher, you're going to have a harder time getting it through. And the last place it gets stuck is here. This is why we have people that are in a lot of pain and then it goes away, because it can get stuck and then it'll start moving again. This is why if somebody comes in with vague pain and we get a urinalysis, it may spill some blood, which is when I see that without an infection, I think, I wonder if they have a kidney stone. That's just one of my differentials we call on my list. Because think about the sloughing that's going on in this ureter. It's going to slough off tissue and then blood, and so it's going to come out the urine. So once it gets into the bladder, usually they will end up passing it. Let's just say you are unable to pass it and you end up having hydronephrosis, swelling of the other kidney, and you can develop an infection then because you're at risk for that. You can have a couple procedures done, which is a laser lithotripsy or SWAL. I'm going to write it down. And SWAL, that stands for extra corporal shockwave lithotripsy. So it's basically the same thing, but what do? They put the patient to sleep. You can look it up on YouTube. The procedure is kind of cool, and they basically blast. They shake your body up to try to shake up that stone, and they put a specified laser on the area. That way you're able to pass the stone on your own. What they usually do, though, is put a stent in the ureter. So it keeps the ureter open, because remember, if there's a stone that's stuck in there or a stone that's caused some issues, the urethra can become swollen. We also can put you on medication. Flomax or Rapaflow is the newer one that we put patients on. This keeps it dilated here. Then it'll end up passing on its own, hopefully. If it's in the in the kidney here, sometimes we have to make an incision here and go in and actually retrieve it and remove it by there. We'll put a drain in for about a day, and then that will end up coming out. As far as this part goes here with the stent, they'll come in after about 4 to 5 days or sometimes a week. Sometimes we have patients with them for a couple weeks or even more, and that is very painful and uncomfortable for the patient. But hopefully they pass all the stones and not have any more issues. Please note that patients with kidney stones usually have recurring kidney stone, which is so important to prevent, and especially these people need to be drinking a lot of fluids. So, a lot. So a gallon of water a day they should be drinking. So make sure you know what a gallon of water is versus mLs versus liters. Those are your conversions that you should memorize. Because you never know what you're going to see also on exams, but then also when you're teaching patients on how to prevent. And that is it, and I hope you never get a kidney stone.